One leaked email. 840,000 patients erased from statistics. Data quality adjustments, hiding the real crisis. And when Kemi Badenoch asked the Health Secretary why NHS England deleted nearly 1 million people from waiting lists, the answer exposed the biggest medical data scandal in NHS history. At exactly 2:17 p.m. on January 29, 2026, Prime Minister's questions focused on NHS performance. Health Secretary Wes Streeting had just spent the morning claiming the government was stabilising NHS waiting lists and delivering on our promise to get the health service back on track. The official figure repeated across every media outlet: 7.8 million people waiting for treatment. Labour benches projected confidence. The messaging was clear: NHS crisis inherited from Conservatives now being managed responsibly. But Kemi Badenoch had spent 4 days with documents that would detonate that narrative. A leaked NHS England internal email dated December 3, 2024, from Chief Executive Amanda Pritchard to regional directors. Subject line: Q4 data reporting, headline management strategy. The email's key instruction was buried in paragraph 3. Following data quality review protocols, we have reclassified 840,000 patient records as requiring validation review, removing them from headline waiting list figures, pending resolution. Translation: 840,000 real patients waiting for real treatment, deleted from official statistics because their presence made the numbers look politically unacceptable. The email continued with chilling bureaucratic precision. This adjustment, combined with exclusion of 12+ hour AANDE waits from published metrics per existing protocols, will present a more balanced narrative ahead of Q4 ministerial briefings. It wasn't data quality, it was data manipulation. And Kemi Badenoch had the email to prove it. The chamber was packed. Conservative MPs had been messaging about NHS statistics bombshell. Labour dismissed it as typical opposition scaremongering about waiting lists. But the thick red folder on Badenoch's dispatch box, visibly stuffed with documents, suggested this was different. Wes Streeting delivered his opening statement with practiced confidence. Record NHS funding. 300,000 additional appointments monthly. Waiting list stabilisation at 7.8 million, down from projected 8.2 million under Conservative trajectories. He spoke of transparency and accountability, while fixing the broken system we inherited. His tone was clinical, technocratic, suggesting competence and control. Labour benches applauded. Conservative MPs sat silent, waiting. Then Kemi Badenoch rose. She began with careful acknowledgement of NHS staff working under pressure. Standard parliamentary courtesy. But her hand rested on the unopened folder, and observers recognized the pattern. This was set up before annihilation. However, Mr. Speaker, Badenoch continued, her voice shifting to forensic precision, the British public deserve to know the truth about NHS waiting lists. The real numbers. Not adjusted numbers. Not managed numbers. The truth. The chamber quietened noticeably. This wasn't going to be a general NHS debate. This was about data integrity. She laid out context methodically. Labour's campaign promise to cut NHS waiting lists. The repeated claims about stabilisation at 7.8 million. The importance of accurate health data for proper resource allocation. She was building a prosecutorial case. Labour MPs shifted slightly. Standard NHS attacks. But something about Badenoch's calm, the specificity, created tension. Then, at 2:23 p.m., 6 minutes into her response, Kemi Badenoch opened the red folder. Mr. Speaker, I have here an email from NHS England Chief Executive Amanda Pritchard to regional directors dated December 3, 2024. The silence was immediate. Streeting's face tightened visibly, his jaw clenched. An internal NHS England email from the CEO shouldn't be in opposition hands. This was a leak from the highest levels. Badenoch held up the document, NHS England letterhead clearly visible. Would the Health Secretary like to explain to the House why this email discusses removing 840,000 patients from headline waiting list figures through what it calls data quality reclassification? The number detonated. 840,000 patients. Not a rounding error. Not a minor adjustment. Nearly 1 million people erased from official statistics. Conservative benches erupted. Labour MPs froze, many clearly hearing the figure for the first time. But Badenoch wasn't finished. She let the chaos subside before delivering the next blow. And would he further explain why the same email states that excluding 12-hour-plus AANDE weights from published metrics will, and I quote, present a more balanced narrative ahead of ministerial briefings? The phrase more balanced narrative was devastating. Not accurate data, not complete picture. A narrative. Managed, adjusted, political. Streeting shot to his feet, visibly rattled. Mr. Speaker, the Right Honourable Lady is misrepresenting routine data quality processes that every health system uses. Defensive immediately. No denial of the 840,000 figure. No explanation of balanced narrative language. Just accusations of misrepresentation. NHS data integrity is paramount, Streeting continued, his voice rising. We conduct regular reviews to ensure accuracy. What she's describing is standard validation protocol. Badenoch remained standing, perfectly still. Then she struck with surgical precision. Mr. Speaker, standard validation protocol. This leaked email from the NHS chief executive explicitly states that removing 840,000 patients from statistics will present a more balanced narrative. That's not validation, that's manipulation. 3 seconds of calculated silence, long enough for the distinction to register with everyone watching. Perhaps the Health Secretary can explain why NHS England's own internal communications describe this as headline management rather than data quality improvement. The phrase headline management was the killer. Taken directly from the email subject line. Undeniable. Documentary. Proving this was about managing political perception, not improving data accuracy. She pressed forward relentlessly. Furthermore, Mr. Speaker, if the official waiting list is 7.8 million after removing 840,000 patients for validation, what is the real waiting list? Is it 8.64 million? The mathematics was simple and devastating. 7.8 million plus 840,000 equals 8.64 million. The real number. The hidden number. The politically unacceptable number that NHS England had buried through data quality adjustments. The chamber descended into chaos. Conservative MPs roared approval. Labour benches erupted in angry defensive shouts. The Speaker banged his gavel repeatedly. Through it all, Streeting stood at the dispatch box, face flushed red, shuffling papers frantically. His prepared talking points about NHS improvement were useless against documented evidence of data manipulation. When order restored, Streeting attempted recovery. These patients have not been removed from care. They are receiving treatment. This is about ensuring statistical accuracy. Evasion. He'd been asked about the real waiting list number. He'd answered with assurances about care delivery. The dodge was transparent. Badenoch smiled slightly. The satisfaction of watching an opponent confirm guilt through evasion. Mr. Speaker, the Health Secretary says these patients are receiving care. But according to this leaked NHS England data quality review document, the longest current wait among the 840,000 reclassified patients is 847 days. That's a cancer patient, Mr. Speaker. Waiting 847 days for treatment while being statistically invisible. The human cost landed with devastating impact, not abstract statistics. A cancer patient, 847 days, deleted from official numbers while their disease progressed. In Birmingham Queen Elizabeth Hospital alone, 27,400 patients were reclassified as data quality issues. In Liverpool, 18,600. In Leeds, 14,700. These aren't data errors, Mr. Denker. These are real people waiting for real treatment, removed from statistics because they made the government's numbers look bad. The geographic specificity was surgical, not vague national figures. Specific hospitals, specific cities, specific patients in identifiable communities, each number documented in the leaked review. How does the Health Secretary justify telling the British public the waiting list is 7.8 million when his own department has hidden 840,000 additional patients? Streeting attempted another deflection. We've been clear about our methodology. We're committed to transparency and improving data collection systems. But catastrophic damage was done. Confronted with 840,000 hidden patients, specific hospitals, an 847-day cancer wait, he'd responded with vague commitments to methodology improvement. No explanation, no justification, just bureaucratic deflection. At 2:37 p.m., 14 minutes into the exchange, the session moved to other questions. But the scandal had triggered. Within minutes, social media exploded. By 2:40 p.m., #840000, Hidden was trending on X. Conservative operations flooded platforms with clips. 840,000 patients deleted. Real waiting list, 8.64 million. 847 days cancer wait, statistically invisible. By 2:48 p.m., the main video had 2.4 million views. Kemi's revelation, the leaked email reference, Streeting's evasive responses. By 3:02 p.m., 4.8 million views. Medical professionals began sharing the clip, expressing outrage that patients were being erased from statistics. By 3:17 p.m., BBC News interrupted programming. Questions raised over NHS waiting list accuracy after leaked email reveals 840,000 patient records reclassified. The Guardian ran analysis. Health Secretary unable to explain headline management strategy for NHS data. Conservative headquarters circulated detailed briefing at 3:25 p.m. The NHS cover-up. How Labour hid 840,000 patients. The document contained leaked email excerpts showing headline management language, hospital-by-hospital breakdown of reclassified patients, comparison of 7.8M official versus 8.64M real figures, 847-day cancer wait case study, and methodology showing AANDE 12-plus-hour waits also excluded from published stats. Downloaded 103,000 times within 5 hours. Behind closed doors, NHS England descended into crisis. The email was real. The 840,000 figure was accurate. Amanda Pritchard faced immediate calls for resignation. How do you defend headline management language in official communications about patient data? Department of Health's 5:45 p.m. statement was transparently inadequate. NHS England conducts regular data quality reviews to ensure accuracy. All patients remain in the system receiving appropriate care. It avoided mentioning 840,000 headline management or the real 8.64 million figure. That evening, medical professionals spoke out. Royal College of Nursing issued statement expressing deep concern about statistical integrity. British Medical Association called for independent audit of waiting list methodology. Senior consultants described 847-day cancer wait as unconscionable and hidden from public view through statistical manipulation. Weekend polling confirmed devastating impact. Trust Labour on NHS dropped to 21%, down from 52% pre-scandal. In NHS-heavy constituencies, Labour vote share fell 13 points. Most damaging, when asked, is the real waiting list higher than government claims? 74% said yes. By Monday, pressure mounted on Amanda Pritchard. The headline management email became indefensible. On Tuesday morning, she announced resignation, citing need to restore confidence in NHS data integrity. 3 Labour MPs with medical backgrounds issued joint statement demanding full independent review of NHS statistics methodology. 5 more privately expressed concerns to whips about data credibility. The Telegraph's front page showed 2 numbers side by side. Official, 7.8M, crossed out, real, 8.64M in red. Headline, 840,000 patients Labour tried to hide. 4 days after PMQs, Streeting attempted damage control with speech at hospital, claiming government committed to transparent data reporting. But nurses outside held signs, "We're still waiting," and "Count all patients, not some." Kemi Badenoch had achieved something remarkable with 1 leaked email and 14 minutes of questioning. She'd exposed gap between Labour's NHS statistics and reality of patient experience. Not through hyperbole, but through documented evidence, NHS England couldn't deny without confirming the manipulation. Sometimes most powerful weapons aren't elaborate attacks. Sometimes they're leaked emails with phrases like headline management, specific patient numbers hidden from view, and questions forcing evasion so transparent it becomes admission of guilt. That's what happened on January 29, 2026, when Kemi Badenoch revealed that 7.8 million waiting list was actually 8.64 million, and the health secretary had no answer that didn't confirm patients were being erased from statistics to manage political narratives.